morning. I'm gonna do the cuff care and everything. So first thing I always gonna do is check the patient's chart, gather any necessary information that I need. Then when I'm ready and I have all of my necessary items, then I'm going to go ahead and knock on the door, introduce myself, and then I'm also gonna describe kind of what I'm gonna do to them, even if they may not be completely there with me. I can then go ahead and check the patient's ID band, always check their name and date of birth. Wash my hands, apply appropriate PPE, assess the patient, listen to the patient's lung sounds, listen to their cuff, where the cuff is, see how it's sounding before you begin. And then always before you do any of like the cuff care and everything, so you always want to do your next cleaning. So you want to do your mouth cleaning with the patient. So this patient's going to have an endotracheal tube, so you're always going to want to look to see what size of tube they have placed in. And then you're also going to notice where the ET tube is placed on the mouth, so how far it's out, where the number is at placed. And so then when you're ready, then you're going to go ahead and do your oral care with the patient. So I'm going to do the suction swab. So you're always going to have your suction canister hooked up already, and you're always going to have your anchor in there. So always before you do your oral care, you want to go ahead and suction out the patient. So you want to suction any excessive secretions, especially when you're going to loosen up that cuff pressure. So you don't want them to aspirate anything that could be sitting in the back of their throat. So you don't want to make it induce that gag reflex when you're cleaning. So when you got it all suctioned, then you can go ahead and do your cleaning care. So this one you can actually connect to your suction handle here. And then what you're going to do is take your solution, you're going to dip it in the oral dividing solution here. And then you're going to go ahead and wash on the side of the cheeks, the gums, the tongue, anywhere that there could get anything built up, so that way they don't get any sores in their mouth. And what you're going to do is after you're done with that, you can turn on your suction and you can suction out some of that stuff that they have in the mouth, excessive. And if you feel like you still have some, and you always dispose of that, and if you have any more, you can always reconnect it to your anchor and suction out any of that excessive stuff before you begin. So when you do any oral care, you always want to apply moisturizer to this. So you're going to spread it on there, and then you're going to do the cheeks, the gums, anything like that can get dry from being on oxygen. And you're also going to get the lips. And always dispose of anything with the oral care when you're done with it. Alright, so then our next step is to do the MOV. So you're always going to get everything set up with your cuff pressure meter and everything. So here we're going to have the attachment. So you're going to have a little picture of an attachment. So you're going to have your this connected here. Then you're going to have a tubing to that's going to be your guideline of where you're at with the pressure. And then you're going to connect this to here. So that way when you start releasing, then you can start noticing where it's at and be able to chart the numbers where it's set at. So when you're doing that, you're going to always listen, kind of see if there's any leak or anything like that, see how tight it is to the patient. And then the next step would be the minimal leak test. So what you're going to do is slowly release pressure while you're listening to the patient with your stethoscope. You're always going to have that placed on there. And so what you do is you would slowly release the pressure, and you would watch to see and listen to when you start hearing that leak. And so you're going to chart down when you start hearing that leak and everything. And so then when you always are done, you always want to make sure you put the pressure back to where it's supposed to be. So this here can show you where you're at. Oops. So this can show you where you're at, and then if you're not quite in the appropriate pressure of the 20 to 30 in the green, then you can either push the ball very gently, carefully, and if it's too much, then you can use this red and you can release a little bit, but always check to see where your pressure is at and listening to make sure you don't have too much of a leak and it's not too tight on the patient causing sores or irritation. So when you're all finished, you're gonna go ahead and check the patient, and you're always gonna switch their ET tube, endotracheal tube there, to a different side than what it was at, so that way you don't get sores from it sitting in one place. So you're gonna go ahead and reassess the patient, check the patient's chart, see how they're doing, and then you're gonna remove anything that you had that needs to be disposed of, especially like your gloves, and you're gonna wash your hands, and then you're gonna go out and chart on the patient's chart and notify anybody that may need to know kind of where their cuff pressure is at.